Hi, everyone. My name is Jen Licata. I'm the Strategic Partnerships Manager here at K9 Partners for Patriots. We are so glad to have you guys here today and joining with us. We're going to talk a little bit about the mental health aspect of our program. It is a huge part of our program, and I thought who better to have than two professionals who know all about the mental health aspect, PTSD, TBI, and MST, and to be able to speak on that. So I want to introduce a couple people to you all. First, I have Dr. James Whitworth. He's an associate professor at the University of Central Florida. He's taught graduate clinical social worker courses for 10 years. Dr. Whitworth has also provided private practice counseling for military members, veterans, and their families with depression, anxiety, post-traumatic stress disorder. Lieutenant Colonel retired Whitworth served as a clinical social worker and a mental health officer in the U.S. Air Force for 21 years. He's a former Chief of Air Force Family Research at the Pentagon and also worked 3 years as the Chief of Air Force Family Advocacy Operations and Research. Dr. Whitworth has presented and published research on trauma response, recovery, resilience, PTSD, assessment and treatments, alternative treatments for PTSD, family violence, and building community capacity with military populations. I introduce to you Dr. Whitworth. Thanks so much for joining us today.
Great to be with you guys. My pleasure.
So if you could just share a little bit about your role with K9 and how you are part of our team here and what you kind of do to work with our veterans.
You betcha, Jen. My primary role right now is to provide program evaluation projects and somewhat research for K9 Partners for Patriots. And so what that means is as I'm working with the team there to try to better understand the benefits and outcomes, what happens when veterans participate in the program, to try to measure those and gather that. The other role I have, and I've been doing this for several years with several colleagues, some from St. Leo University, another from here at University of Central Florida, is to actually do some different research projects into what might be happening there as well too, which involves a little bit more controlled aspects of research. But love the agency, and I probably the most important things about me is that, number one, I'm a veteran, like a number of folks, and I care about them. I also love dogs as well too, so that's what drives me to be part of this program.
Well, we are very honored to have you as part of our extended program and part of our family here at K9. Another person I would like to introduce to you all is Denny Brown. He is a licensed clinical social worker, and if you've been around K9 for any sort of time, I'm sure you have seen him. He's been with K9 for about 4 years now. He has a bachelor's and a master's degree in clinical social work from St. Leo University, and he's currently a licensed clinical social worker here in the state of Florida. In addition to working with K9 Partners for Patriots, he also operates a private mental health practice here in Newport Richey, Florida. Some of the services that he provides for K9 include individual counseling as needed, social and emotional support, case management services, veterans, spouses, group support, and regular follow-up and communication. Denny Brown, thank you so much for joining us today. Can you share a little bit more about your role here with K9 and just how important and crucial you are to our team?
Thank you, Jen. Well, as you mentioned, I do individual counseling on a case-by-case basis. Groups are very important as well. We do the spouse group. We have a co-ed veteran group. We have a female veteran group. And those been running for about 3.5 years. And thankfully, they are a lot of interest in those groups, and they've been going well. Also, we conduct the research for Jim so he can get that information. When the veterans first start, we kind of give them a pre-test, kind of assess where they are at that time. And then we give them another evaluation when they graduate, and to see how the program is affecting them, whether, if this is a benefit for their lives and that kind of stuff. But as Jen mentioned, I've been with the program about 4 years, and it's been a great experience, and it's wonderful to see what the dogs can do to help these men and women. But that's basically my role here.
Awesome. Well, like I mentioned, Denny, we are so honored to have you as part of our team. You do play a crucial role in our program, so we are very thankful for you. Now to kind of get into the topic, Dr. Whitworth, I'm going to direct these questions towards you first. Can you tell us a little bit about what exactly post-traumatic stress disorder is and what those symptoms would show as?
You bet. It's important to, when you think about post-traumatic stress disorder, is that it really can be a response to a number of different threat environments or threat situations. I'm going to talk almost exclusively in my explanation or response to your question about military members and veterans, to some degree their families members, how their brains and bodies might react when they're exposed to a threat, and how that might result in a trauma response for a prolonged period of time, which would be post-traumatic stress disorder. So when you think about what happens in military deployments, or a lot of military experiences, some military experiences, especially in an area of operations like in Iraq, Afghanistan, Syria, some places in Africa, the continent of Africa as well too, where we're currently or have been deployed, our military services have been deployed, is those are threat environments. So military members, combatants, those who take weapons with them and are actually trying to kill the bad guys, if you will, the people that are trying to kill us, and we're as part of our military mission. But there's also a number of other threats in those environments as well too. So if somebody's trying to kill you and you're trying to stay alive, that's obviously a threat, combat. But also there's a lot of explosives that are part of modern warfare as well too. Improvised explosive devices, we call them IEDs, or mortars, other threats like that. And we also should keep in mind that sometimes, unfortunately, service members can be a threat to another service member, such as the case of military sexual assault, which happens as well too, and can happen in a deployment environment. But in any of these situations that I'm describing, the individual military member perceives a threat to not just usually themselves, you know, in terms of being harmed or somebody trying to kill them, but also a threat to the people that they care about, the other people, members of their unit, part of that they're connected to as well too. Whenever that threat is present, our brains do a number of very predictable things. And to state it somewhat simply, is our brain kind of goes into an alarm stage. An alarm stage where we are kind of hyper alert, hyper focused, quickly able to respond. And this is what we all need to sort of, in a response to the threat environment, we need that ability to do what's commonly called the fight or freeze state, is to go into this alarm state. And that's needed during a time of battle for the warrior, military member, to be able to deal with threats, eliminate those threats and respond to them. That's a very natural process. The problem is that we as human beings have a hard time sometimes turning off that alarm state, especially when we've been in that alarm state for a prolonged period of time. And almost in some ways, especially for our military members, it becomes almost a new normal that the body and brain kind of get used to, and it almost wants to stay in that environment to some degree, that alerted, highly alerted alarm state as well too. So in that new normal, they come now back from that deployment and try to be a dad or a mom, a spouse, partner, parent, or even just a regular military member in their normal role. It can be sometimes difficult because they have trouble dialing it down. They'll use that term, dialing it down. And that's what they're talking about, is they're really in this higher state of responding to threats, which works, again, quite helpful to some degree in a threat environment, a combat, but very difficult when they're back here in a non-threat environment, because they're sometimes seeing threats, but they're not. Sometimes they're having severe difficulty with sleep. A lot of times they're avoiding things related to the threat situation as well too. And what most commonly we see in our veterans, especially in the settings like you guys deal with, is they're kind of quick to anger. They can be triggered. What do we mean by triggered? Is something reminds them of a threat, something that may not be a threat to us, but it might be a threat to them. I think of one warrior that I saw in Iraq many years ago. He kept losing weight, and they couldn't figure out why he was losing weight. Sent him to the medical doctor and everything. Eventually sent him to me. We figured out, along with talking to his commander and first sergeant and everything, that he wasn't going to the dining facilities, the places to eat. We call them defects over there, because he was so afraid of the people that were there. Or not afraid, he saw them as threats there. And so to his mind, of course, these were actually people working in the dining facility weren't even Iraqis. They were from other countries, third country nationals, we call them. But in his young mind, he perceived them as a threat. And so that's an example of how avoidance was significantly impacted, and he was in this higher altered state. The other thing to say is that, I'll just emphasize again, is that for warriors, sometimes this becomes that new normal. The other aspect that's really important to understand for many military members is the active, especially those who have deployed and been actively involved in combat and taking lives, is there's a sense sometimes of guilt and self-anger that is there with some, because of their role and what they had to do. And it's sometimes really, they're not forgiving of themselves for that. Sometimes the same thing, they would forgive another military member for that, but sometimes not forgive themselves for that for what they had to do. When they look at it from the outside, they can see that a fellow military member, soldier, Marine, airman, or sailor had to do that job, had to take a life, or had to do some actions in order to protect themselves and others around them. But when it comes to themselves, sometimes because they made it through, or because of what they actually had to do in terms of taking life, that they have some sense of guilt. And so that is an aspect too that that can be very present with a number of military members and now veterans like you guys see there.
Absolutely. So what are the statistics that surround PTSD in our veterans and active duty members?
It varies, it depends on which researcher you talk to, but for the most part, it's our best guess is that between 15 and 25% of all military members that have been deployed experience some level of, or some relatively significant level of post-traumatic stress disorder. And our guess also is that it's bigger than that, that there's other folks with what we call a sub-threshold PTSD response, where they're still meeting, having some of the difficulties, but not having the same level of difficulty.
That makes sense. Wow. Wow. That's incredible. So Denny, I have a couple questions for you. So how does our program specifically work and combat the issues surrounding post-traumatic stress disorder?
Well, it really starts with the first interview, the first initial contact that our veteran liaison kind of makes with our veterans. Providing that place of acceptance and non-judgmental place for them to come. And I think that is the biggest thing, because so many of our men and women who reach out to us, they've been isolated for years, whether that is, from their family members, from friends, because again, what Jim was talking about is that that kind of distrust of others, and kind of everything is perceived as a threat, or that overwhelming guilt that so many of our men and women struggle with that moral injury that they kind of experience in combat, which is a lot, and I see that quite a bit here. So they kind of withdraw from their loved ones because in their minds, maybe I'm not worthy of the love that you're willing to give me, or again, I just distrust what you're going to do, and if I'm in control, I can end it now, and we don't have to, you're no longer a threat to me. So the initial contact is important. They come in, they're obviously very nervous for that first day, but we try our best to provide a family-friendly environment to where they feel, for the first time in many years, at ease, and we do our best to try to provide a non-judgmental atmosphere, and many of the men and women are in the same boat, so they kind of understand what the other veterans are going through. So there's that level of support that people like myself can't give. And then you bring the dogs in, and the dogs are able to kind of be that 24-hour support. You know, these dogs are with them all the time. I can't be with these men and women, you know, very limited basis as far as, you know, maybe an hour or so, you know, when they're here each week. But the dog is with them 24 hours a day. The dog also helps them to start getting out of the house, because now all of a sudden they've got to take the dog for a walk. They've got to take care of this, you know, this animal that they have now, and that actually forces them to start getting out. And then, you know, what happens is, oh, they realize this isn't that bad. I can now start to do things again, and that builds. As far as the training is concerned, we teach them, you know, the trainers do a great job of kind of teaching them different skills on how to kind of maybe better manage their anger when they're faced with different things out in public. You know, whether first response is kind of either a physical threat or a, you know, a very verbal, you know, explosive kind of four-letter word, or the, you know, but those are the kind of the basic things we do here to kind of help our men and women.
Awesome. That's really amazing. So another question for you, Denny. Can you share a little bit about the pre and post test and how those are conducted here with our veterans?
Well, for the past probably 5 years, we've been doing it when they first come in. It's started with 136 questions. So they answer those questions on their first day. Probably about a year ago, we added an additional 20 questions to that, a different survey, but to help us gain more information. And then once that's completed, normally, you know, I would either send it to Jim or whoever we were working with at the time, and then he analyzes the data after they do their post test and when they graduate. But we are actually going to a new format, which Jim has been working on very hard. We're going to be doing that. Basically, it's an online survey. It's going to be, I think, much easier for the veterans to complete, because unfortunately, the questions that we were, you know, it's very invasive. It's very, you know, because we ask a lot of kind of very personal questions to kind of help. And so it's very difficult. So we're trying to make it easier for the veterans, easier for us as well. But I'm excited to get this new program up and running. And I think the plan is June 24th, I believe, we're going to start the pilot program on that. So, yeah, so far we've got great results, which Jim can speak to as far as the data is concerned.
Absolutely. So Dr. Whitworth, that kind of continues on to my question. So tell us a little bit about the analysis of the pre and the post test, and why is that so critical for what we do to be able to have that data?
Of course, Jen, I'm happy to do that. Well, one thing we do know, first off, this is a bit of an aside from the pre-post data, is that compared to some of the other standard research-based approaches to help people with PTSD, the kind of stuff we're talking about, is that military members and veterans are far more willing to go to programs like this, like K9 Partners for Patriots, especially when they're set up the way that K9 Partners for Patriots is. So from that to the main point here in terms of the pre-test, post-test data, some of the key findings we're seeing, and remembering that many of the veterans are coming in and they're in this higher state, alert state that I described a few minutes ago, is that many of them describe being able to dial that down much better, kind of getting somewhat of a steering wheel, if you will, on being able to manage how they respond to their environment around them. So we see some decreases in anger, some improvements in terms of their hopefulness as well too. But I think one of the most significant aspects, and there's others to talk about as well too, that we see from pre to post, is that the veterans, when they complete the program, they're far more willing to be around other people. Just like Denny was saying, is that so many of them, because of what was going on, they're very avoidant, very isolating of themselves. And so this program, to some degree, through the dog, through relating with the other veterans, through the trainers and everything, it really kind of pushes them to be now around other people. And it's, we believe, from the research and from other findings as well too, that it's in the context of relating to people that understand, not just people, but relationship with the dog, relationship with other veterans, relationships with having a good folks like Denny there, and the trainers, can really help the veteran to then, on the post test, it appears to have a significant benefit in terms of their now being able to be around others and not self-isolating so much. Other things on the post test, we're seeing major decreases, or we call them significant, statistically significant decreases in some of their hyperarousal, being on edge all the time, hypervigilance, always looking for, where's the next threat, what's going on there. And as I mentioned earlier, some improvements in their mood and anger, not perfect, they're still human beings, and they've been changed from their experiences as well too. And some also decreased avoidance of being able to, of anything that reminds them of their experience, being able to talk about that as well too. And in some cases, some improved sleep, which is so fundamental. When you think about the opposite of the alarm stage we're talking about, the opposite of that is being able to rest. Being able to rest, for our brains and bodies to be able to rest. And so some of them a number of them are having some improvements there. And we think it's through, at this point from the research, it's through the context of these relationships that they're getting these benefits.
Wow. Wow, that's so amazing in so many different ways, just the impact that we're able to have on these men and women who have already sacrificed so much.
Mm-hmm.
Denny, a question for you. What are we doing to work towards being a pioneer in the elimination of veteran suicide, and how does that play into the PTSD?
Well, I think, we're not really reinventing the wheel here. I mean, this is but I think what is the biggest benefit, again, as I spoke to before, the dog is with them 24 hours a day. So if they wake up in the middle of the night and having a nightmare, there's something there to comfort them. They don't have to think, oh my gosh, if I call someone right now, they're going to be upset with me or whatever. But the dog is always there. The dog can also help with that kind of, as Jim mentioned, the hyperarousal. They don't have to be on alert all the time, because the dog is there. It's going to kind of be that alert for them in some ways. They're going to kind of, dogs have kind of superpowers, so they can kind of alert you when someone's, coming up the street or whatever. So the dogs, I think, are the biggest factor in what we do here, because, we've had veterans where they were getting to a very, very dark place, and all of a sudden the dog is there to break their concentration, and they no longer follow through with those either suicidal thoughts or acting out towards others, in a violent way, because the dog kind of breaks them out of that kind of moment of anger or increase, the depression that they're going through, regardless of what's. So that's, I think, is the biggest kind of thing we're offering here. So.
That's awesome. Last question, Jim. Dr. Whitworth, I'm going to direct this towards you. Can you share about the results of your recent study? I know you did a study recently specifically on veteran spouses. What did you find out from that study?
You betcha. Happy to share that with you. One thing I will say before even mentioning about that study is, one of the unique things about the work that we're doing in terms of research there is that we are totally separate. Our research and K9 Partners, for Patriots, totally separate from any formal governmental system in terms of like the VA. So the questions that we ask, and we're trying to shrink those online, like Denny was describing, are all totally confidential. In fact, the veteran comes into the program, they get an ID. They're a participant ID, a veteran ID. And so I never actually have, as a researcher, I never actually even know the veterans' names, which is very helpful. So, and none of that, I have no connection to the VA or any other formal governmental system in that sense. So that puts them, I think, at ease as well, too, the many veterans at ease. Now, in terms of the spouse study, we're just wrapped that up, and we're awaiting the findings to be published. We're very close to them being published. What we learned, and I think actually this was the first study, this was the first study in the country or the world to really try to understand the spouses, the veteran's spouse or their partner's perspective on all of this. When you think about it, they're the ones usually that are kind of nudging that veteran, hey, what about the service dog program? What about K9 Partners for Patriots? Or driving them there. And that was kind of one of the first things that we learned, was that these spouses and partners are just incredible heroes. They do an amazing amount of work, emotionally, physically, everything you can imagine, to try to support. And their level of commitment to these veterans is just unparalleled. It's a beautiful thing to see. Now, as part of that, we wanted to understand their view on all of this process, sort of what we call a qualitative sense. We really did in-depth interviews, trying to listen, really for us to be quiet and to listen to them. And what they told us is that when you put it all together, is that they saw that when their veteran participated in a program like K9 Partners for Patriots, is that they felt relational, they felt connected on a relationship level on three different ways. First off, that bonding relationship, as Denny was talking about, with their service dog. And it's a special, beautiful bond. So we understand that part, that's one part of this bridge to getting better, to starting to be able to dial it down and to feel a bit like they're connecting with the rest of the world. So that's one aspect of the bridge. The other aspect of the bridge that the spouses and partners saw was the veterans' ability at K9 Partners for Patriots, the opportunity for them to be around other veterans, to share their story, be real, and to hear other veterans talk about what they're experiencing. So that was a significant relationship, sort of the second level of the relationship. The next level was the relationship from the spouse's perspective, was that the veterans were able to connect with the trainers through the counselor, Denny here, and through other staff, people that just were very accepting and connecting with the veterans. So those three aspects seem to be the key from the spouses and partners perspective of what's happening there at K9 Partners for Patriots in this service dog training program.
That is amazing. Well, I think that about wraps it up. Dr. Whitworth, Denny, I know I speak for the whole K9 team. We are so appreciative of you all and just the wealth of knowledge and expertise you guys bring to our program so that we can continue to serve our veterans. Thank you guys so much for spending time with me today.